Is my tremor essential tremor or Parkinson's tremor? Imagine trying to figure out if that shaking in your hand is just a normal tremor or something more serious. Understanding the differences can be tricky but is important for proper diagnosis. Tremors are common, but their patterns and associated symptoms can tell us a lot about their cause. Essential tremor usually happens when you are actively moving or holding a position. For example, you might notice your hand shaking when you are trying to write, drink from a glass, or hold something steady. This type of tremor is called an action or postural tremor. It tends to affect both sides of your body equally from the start, often involving the hands, head, and voice. The tremor is rhythmic and tends to have a higher frequency, around 8 to 12 cycles per second. People with essential tremor often notice that their tremor gets worse with movement and may be more noticeable when they are anxious or tired. In contrast, Parkinson's disease usually causes a tremor that appears when your muscles are relaxed and at rest. This is called a resting tremor. You might see your hand or limb shaking even when you're not trying to move it. Interestingly, resting tremors in Parkinson's often lessen or stop when you start moving intentionally, like reaching for something. The tremor in Parkinson's is generally slower, with a lower frequency, and can be more pronounced when the person is calm or at rest. It often begins on one side of the body, typically in one hand or limb, and may spread to the other side over time. Another key difference is in other symptoms. Essential tremor usually occurs without other neurological signs, although it can sometimes affect the voice or head. Parkinson's disease, however, involves additional features such as muscle stiffness, slow movements, difficulty with balance and coordination, and a masked facial expression that looks less expressive. These symptoms tend to worsen gradually over time, reflecting the progressive loss of dopamine-producing cells in the brain. Family history can also provide clues. Essential tremor often runs in families and tends to progress slowly. Parkinson's disease has a less common family link, affecting about 10 to 15% of cases, and involves broader motor and non-motor symptoms. Diagnosis is made by a neurologist who will examine your tremor pattern, look for other neurological signs, and may perform tests to help distinguish between the two. Sometimes, how you respond to certain medications can also provide clues. If your tremor mainly occurs when your muscles are at rest, starts on one side, and is accompanied by stiffness or slow movements, it is more likely to be Parkinson's tremor. If your tremor happens during movement, affects both sides equally, and is not associated with other symptoms, it could be essential tremor. Because these conditions requiring different approaches to management, it is essential to see a healthcare professional for an accurate diagnosis. Remember, each person's experience is unique, and only a doctor can provide personalized advice. If you are concerned about your tremor, scheduling an appointment with a neurologist is the best step to understand what's happening and explore your options for care.